So prior to starting the procedure, we're going to increase the oxygen to 100%. We'll ensure that the ET tube has soft ties, and that we'll note the length of the teeth, which in this instance is 25 centimetres. Everybody in the team is trained and understands the procedure, and we've established that the patient doesn't have any contraindications. We're all aware of where the emergency equipment is located, both airway and resus. The patient's eyes are taped and lubricated. The NG feed has been stopped, and the NG tube has been aspirated. We've disconnected all monitoring apart from arterial line and capnography. And we've established there's adequate length on the infusions. Any non-essential infusions has been stopped, and the lines have been positioned appropriately. If the patient had a chest drain at this point, we'd consider clamping or keep below the level of the patient. We need to establish that we've got an adequate number of pillows and sheets. So we need 2 pillowcases, 4 pillows, an additional sheet and a sliding sheet. In a moment, we'll adjust the height to the height of the bed to the airway doctor, and we'll allocate roles. So we have 1 airway doctor, we have shoulder person A on the right hand side, shoulder person B on the left hand side, and 2 people on the hips. So now I'm going to confirm the rolling sequence to the team. So the instructions will be ready, steady, slide, and then we will slide to the left, then ready, steady, roll. We'll roll into 90 degrees. We will then deliberately swap hands sequentially, shoulders first, followed by hips. Then ready, steady, roll into prone, ready, steady, slide into the middle. At that point, we may have to reposition the sliding sheet before moving up the bed. So, if we can remove the pillow.
1, 3, 1, 2, 3.
And let me know when the height of the bed.
Thank you.
Okay, if we get a slidey sheet, please. Okay. We're going to tilt the patient towards us. Ready, steady, tilt. On back, ready, steady, back. And we should be able to reach through to find the sliding sheet. Okay, at this point we need the pillows. So we have 2 pillows stuffed in 1 pillowcase. The top needs to be positioned as high up to the patient's chin as possible and over to the right. And the bottom pillow needs to be positioned across the patient's pelvis and over to the right slightly. Then we need the top sheet. Okay. And we're going to make sure there's enough length to cover the patient's head and then come back. At this point, we're going to roll both the top sheet and the bottom sheet together to make a pasty, and to ensure it's tight as possible at the shoulders and the hips. Ensuring that there's no slack. Okay, if we're all ready, first movement, slide to the left, ready, steady, slide. Second movement is to roll 90 degrees, ready, steady, roll. And now we're going to swap hands deliberately.
Okay.
Thank you.
Okay.
Yep.
Got it.
Roll. And the patient is adequately in the middle and at the head of the bed. Okay, so now we're going to unroll, and we're going to take the top sheet off, remove the slidey sheet, unfurl the sheet, the top sheet, taking care of the patient's face. Kind of position the upper limb and the lower limb, and the hip team will reapply all of the monitoring. We'll then go through the post-prone checklist. So So we need to confirm the ET length. If there are any chest drains, we'll unclamp them. We now need to tilt the head of the bed up 30 degrees. Thank you. We need to review the patient's ventilator setting and consider reducing FiO2. We need to start the NG feed, and we've confirmed that the patient's abdomen is clear. We now need to assess pressure areas to ensure that the ET tube is away from the face, the eyes are closed and padded, the ear is not bent over underneath, the NG tube is not pressed against the nose, and the patient's penis is lying between his legs. We need to finally ensure that there's no lines pressing on the skin. Our post-proning bundle will request an ABG after 30 minutes, and we'll have 4 hourly limb and head positioning. At this point, we'll identify a time for reproning, and finally, before leaving the patient, we'll identify a CPR point with a marker. So we'll assess the lower border of the scapula, come centrally to midline, and move down 2 spinous processes.